SB&K Benefits with another valuable tip.
So today I want to talk to you about how self-funding works, all right? And I've got a real good little diagram for it. So imagine if this is your monthly premium. So say it's $1,000 a month, all right? The monthly premium is going to be divided into two parts under a self-funded plan, all right? You're going to have your fixed cost, and you're going to have your claims cost. All right, fixed cost you're going to spend no matter how your claims run. You're going to spend that money regardless. And in that fixed cost, you have what's called a TPA fee. And what the TPA is, it's a third-party administrator. So when that doctor, that hospital, that employee sends a claim in, the third-party administrator are the folks that's going to review that claim, make sure it's a real claim, and they're going to run it through your PPO discounts, which you'll pay a little fee to access a PPO network for discounts. And then they'll also run it through the pharmacy program, which you pay a little bit of a per employee monthly fee to have your pharmacy program. Like I said, these fixed costs, you're going to spend those regardless. The other part, your claims portion, that is the money that goes to the doctors, the hospitals, the pharmacy, to pay the doctors and the hospitals and pharmacies for the work that they do. So that's your claims dollars. Now under a self-funded plan, really what we look at is a partially self-funded plan. And what partially self-funded means is you got a couple insurance protections that are built into the plan to keep any one employee from using up this claims money, but also to keep a bunch of employees with smaller claims from using up more than what you've budgeted for claims. So actually there's two insurance protections that we build into the fixed cost. All right, the first one is an employee protection, and that is called a specific stop loss, and that's specific for each employee, spouse, child on the plan. And think of it as kind of like the medical plan's deductible. So the way that works, say you have an employee that has $200,000 in claims, all right? The specific stop loss, usually we set that, depending on the size of the employer, between $20,000 and $30,000, maybe even higher. I've had specs as high as $200,000. But anyway, let's use $30,000 as an example. That employee has $200,000 in claims. The medical plan will pay that first $30,000, and the rest of those claims are going to be picked up by an insurance company. So basically, the employer, the medical plan, is off the hook after that first $30,000. All right, so that keeps any one employee from using up all this money. The other one we use is called an aggregate. A-G-G. And the way that works is that's going to protect your whole claims pool here. All right, so that keeps all of the employees from, if you have a bunch of employees and they all have a bunch of small claims, say your claims liability for the year is $100,000, all right? Well, if you have $120,000 in claims, then the insurance company, the aggregate insurance, is going to kick in. So if you end up out here in claims, the ag is going to cover the rest of that money, all right? But say you have a good year under self-funding, pretty cool. Say you end up right here, all right? Well, you as the employer keeps the rest of that money, and you can use that to offset claims costs next year. You can do a premium holiday. I've had some employers that make a deposit into the 401k plan for the employees. As long as you use that on employee benefits, you're still okay. Then the other thing we can do is we can put in what's called an aggregate accommodation. And what this does is it makes your plan fully budgetable. So what that's going to do is that's going to take your claims liability and it's going to break it up into 12 monthly bits and pieces. All right? So say that first month, your claims liability is $100,000, so that's $8,000 a month. So you have $8,000. So say you have $10,000 in claims that first month. Well, that extra $2,000 is going to roll forward into the next month, and that balance just keeps rolling forward all along. So that way, every month, you know what you're going to have to budget for your medical plan. And again, at the end of the year, you got these protections in here. The other thing you got to think about is if you ever go from self-funded to fully insured again, you're going to have things called runoff. All right? So we need to plan for runoff. And what that means is, say an employee has a claim here, but it's not going to get filed until here. Well, then your plan year has ended. So what the runoff does is that helps pay for that claim, and it only lasts for about 3 months or so. All right, and those are things that we can build into your specific stop loss if we need to. So anyway, that's how self-funding works. I hope you found this educational.
Well, I hope you found this information valuable. For more information and more tips, go to SBKbenefits.com or call us at 832-482-2494.